Okay, so today is all about learning about the 5 wishes. There are all different ways that you can do a advanced directive or a living will. But this, I think, is the most easy form, and it's also the most comprehensive as far as an ALS patient goes. As we move through this, you will see that there are areas where you can fill in anything that you want to add, which I think is perfect. Because I think there are extenuating circumstances with an ALS patient and they want to make some exceptions to certain things. And also, this is one form where you do not need a notary, right? So you just need 2 witnesses. At the end of this, it will discuss what it takes to become a witness. I think we have a couple people here that actually want to complete this form today and get it witnessed. For those purposes, I think any of the staff here can serve as a witness. So it is completely up to you whether you want to move along with this and fill it out as we go, or if you just want to listen and take it home and mull it over and maybe talk to your family and that sort of thing. You can fill out the whole thing or parts of it as we go, but it does not become a legal document until you sign it and have it witnessed in front of people. So it's up to you whether you want to do that. That's why we put the pens out, just in case you want to do that. So if you can just turn to the first page, page 2 at the bottom, there's just a little note there about how this began. Jim Towie worked with Mother Teresa for several years, and he also lived in a hospice, and he just saw firsthand experience of what she did. And she, did some extraordinary things with patients. I think we all know Mother Teresa's acts and things like that. And so he was just very inspired by the compassion that she had and that sort of thing, and kind of built this 5 wishes based on that compassion aspect. I know from dealing with ALS patients in the many years that I've done this that, you know, I think that death is a topic that nobody wants to talk about, right? Like we're all like, oh, no, don't talk about it. And when somebody dies, you don't know what to say to that person. And it's just a very taboo topic in our society. And it really shouldn't be. Like we talk about when people get pregnant and have children and, oh, we want to celebrate that. But really, death is a celebration of the life that that person lived. And it's becoming quite popular now that people want to take control of their eulogies. They want to write their own eulogies. They want to have a first-hand in the planning of their funeral or their celebration of life or those sorts of things. I am also a certified end-of-life doula, which means that I help people with that transition. It does not have to be a scary thing. It can be a very beautiful process. So I think when we go through this, it will give you some ideas of what do I really want to have happen at those end stages of my life. As much as we all maybe don't want to do it, we're all going to go through it, right? So I kind of feel like it's one of those things that if I can plan that, I'm very much type A personality and like to plan everything. So why not plan as much as I can what I want for the end of my life to look like? So okay, so when you are thinking about an advanced directive or a living will, anyone over the age of 18 should have one of these. And I know that sounds a little weird, like, really? I'm only 18 years old. Why should I be thinking about my death? But I will tell you that I actually had a person come to me one time. It was a mother, and her 19-year-old son was away at school in another state, and he went to the dentist for some routine procedure. I don't know what it was, but he had a seizure in the dental chair. And so the dentist office called 911 and they sent him to the hospital. And mom called to find out what was going on, and the hospital would not release information because he was an adult. Right? So there was a perfect example that he was not able to communicate his wishes, but he was an adult and he didn't have a power of attorney or anything, and they would not talk to mom. Which, as a nurse, being in the bedside for many years, like, you do have to make those accommodations. You can't just assume that anybody that you're talking to on the phone is mom. Lots of times we have a code word for the family or things like that when people call in. that sort of thing. But you just have to make sure that you are disclosing that sort of privileged information, protected information to the right people. So they probably did the right thing, but it did not make mom happy at all, right? So it does make sense that anyone over 18, a legal adult, you should really have a medical power of attorney. Okay, we all live here in Arizona, so this state does accept this 5 wishes as a legal document. There are a few states that have a little extra factors. Mostly they do want you to have it notarized, but Arizona is not one of those. So you don't need to worry about that. Okay, let's go to page 4 for wish number 1. This is actually picking that medical power of attorney, that person who is going to be making those decisions for you when you are not able to speak for yourself. Now, as ALS patients, we do know that sometimes an ALS patient will lose their ability to speak. It does not mean that they don't have the ability to make a decision for themselves, right? So we have alternate ways that ALS patients can communicate. If you are a patient who is aphasic, which means I cannot speak, but you can still text, you can still write, you can use an eye gaze, those sorts of things, you are still able to make your own decision. And that medical professional should be allowing you that alternate way to communicate. The medical power of attorney only defaults when you are not able to communicate your wishes. Okay, so I just want to make sure that every ALS patient specifically knows that. If you are able to communicate in any other way other than verbally, they need to take that form of communication. So this defaults when you cannot do that. So this page here on wish number 1 wants you to choose typically 3 people, which I always recommend as well. I will tell you that 9 times out of 10, most people pick number 1 as their spouse. Makes sense, right? We typically would. But you have to consider the fact that what if you and your spouse are in a car and you have an accident and both of you are out? Then we want a number 2, maybe even a number 3. What if number 2 is your child, and that child, even if it's an adult child, what if you're all in a car together? It's always a good idea to have a second and a third backup. So that's why there are 3 listed here. I will tell you that even though it's typical that people do have the spouse as their first medical power of attorney, I, for one, am one who does not have my spouse as my medical power of attorney. He's a very emotional person, and I'm pretty sure that in that circumstance, when there might be some very important decisions that need to be made, he might not choose what I want. So my best friend, who's a nurse, is my medical power of attorney. He understands that, but I just think that you have to really kind of make that decision on who is best going to follow the wishes that you want. I will tell you, I had a patient, an ALS patient, who was intubated in the hospital. He went into some respiratory distress, and the doctor needed to remove that intubation tube. And the 2 options were, we either have to put you on mechanical ventilation, so tracheostomy and mechanical ventilation, or we're going to try for you to breathe on your own, and maybe we'll give you a BiPAP machine, that sort of thing. Well, because he was intubated, the tube was in his mouth, he could still write. And he said, I don't want mechanical ventilation. And his wife was standing right there, but she was medical power of attorney. Now, he could still write, right? So the doctor had to listen to him, but she was beside herself. And she said, I'm not ready for you to die, and I want you to go on the vent. And so it was a very, very tumultuous, it was a lot of stress in that room. And the doctor did follow the patient's wishes and told the wife, sorry, we can understand what he's saying. And they pulled that intubation tube, and he went on a BiPAP machine, and he lived for 2 more years. So that was a good scenario, right? But if the doctor would have maybe listened to the wife and not have listened to what he wrote down, it could have been a very different situation for that patient. So just kind of want you to understand. Yeah. Yeah. I mean, you really have to think about things like, I don't know what the conversation was at home that night, but could have been very different. So anyhow, think about who you want to really make that decision for you, And after we fill out this form, you need to have a conversation with that person. Number one, are you willing to do it? And if they say yes, these are my wishes, right? Now, that person can always decide, hey, I decided I don't want to do this anymore. They have a right to say that as well. And if so, then it will default to number 2 or number 3, that sort of thing. But a person can say, I'm opting out at any time. So it does say in here, picking the right person. You can read that paragraph there, but it should not be, just so that you understand here, they have to be at least 18 years old. It should not be your healthcare provider, including the owner or operator of a health or residential community care facility serving you. It should not be an employee or spouse of an employee of your healthcare provider. And it should not be serving as an agent or proxy for 10 or more people. So you don't want to get like a fiduciary that's got multiple people, because if you need that person in crunch time, you don't want them to say, I'm not available, I'm helping somebody else right now. You want to make sure that they are there for you. Okay, everybody understand that? All right, page 5. Okay, so this is what your healthcare agent, medical power of attorney, they're interchangeable kind of phrases. This is what they can do for you. Throughout this booklet, if there is anything that you do not want them to do, you can simply cross out, put one line through, and that will null and void whatever that is. So there are some things that people say, I don't want this person to have the ability to do this. That's fine. You can cross that out. So these are the standard things that agent can do for you. They can make choices for you about your medical care or services, like tests, medicine, or surgery. This care or service could be to find out what your health problem is or how to treat it. It can also include care to keep you alive. If the treatment or care has already been started, your healthcare agent can keep it going or have it stopped. So let's just say that you're at home one day and the neighbor is visiting you, and your healthcare agent is at the grocery store, and you start choking or something, and they freak out and they call 911, and you go to the hospital, and they start doing things that maybe you didn't want. Because I will tell you, in the state of Arizona, a medical professional is going to do everything they can to save your life. 100%. You literally have to have this document in front of their face, waving it at them, or they will save your life. For me as a medical professional, that's a little hard for me to understand. If you've got the documentation, they should follow it. But you can't just say I have it. You have to show them, or they will keep going. So if they've started something and then you get to the hospital and say, hey, no, she didn't want this, you have the right to say that. You have the right to say stop any kind of therapy that they were getting.
Like, could you, if this was on a phone or something, would that show them? Like,
yes.
Or do you have to have the
No, if you have it, that would be okay. For all of you with Barrow and Honor, if you take this to your next clinic, they will upload it into their system so that the hospital has a copy of it. So typically you're probably going to go to that sort of facility anyhow. St. Joe's, Honor, one of those facilities, they would have it in the system anyhow. But yes, you can have it there as well, and they will honor that. But you have to show them. You can't just say, well, I'm the wife and I say. You have to show the document. But you can have it stopped. So just so that people understand, if something has already been started, you can't be like, oh, shoot, got here too late. No, you have the right to say, I want this stopped. You can interpret any instructions that were given in this form or any other discussions according to my healthcare agent's understanding of my wishes and values. So that basically means if you fill out this entire form, it's signed, it's legal, and then next week you guys have a discussion about something. Let's say you decide, I know I told you I wanted a feeding tube, but I changed my mind and I don't. And then the week later, you go in and the doctor says, I need to put a feeding tube in. You can say, hey, my person told me last week over dinner that they didn't want this. Your interpretation of what that person says counts. So you can say that. We had this discussion. This is what they said. they will honor what you say as an interpretation of a discussion. They can consent to admission to an assisted living facility, a hospital, a hospice, or a nursing home for you. They can hire any kind of healthcare worker that you may need to help take care of you. They can also fire a healthcare worker if needed. So lots of times when patients are talking to me about, oh, maybe I'm ready to hire home health, that sort of thing, I also say to them too, like, just because the first person that comes out is help doesn't mean that you're going to jive with them, right? Like if they're doing a very intimate thing, most times they're helping with bathing, toileting, something like that. I don't care if they do the job fine. If you and Susie don't get along personality wise, then call that agency and have them send somebody else out. You're paying for it. They're coming into your home. They're doing things that require you to have that connection that you want to have. So if you need to hire and get somebody else, feel free to do that. It is not uncommon for agencies to do that over and over again. So don't feel bad if you have to go through 3 or 4 before you get the right one. That's your prerogative. And we want you to at least take advantage of having that person in your home. So if you cannot voice that opinion, your power of attorney may do that for you. Your power of attorney can make the decision to request, take away, or not give medical treatments, including artificially provided food and water and any other treatments to keep you alive. So let's say you have a feeding tube and you've had it for a while and you are end stage ALS and you and your medical power of attorney have decided, listen, when I get to that point where I've had enough, I want them to stop giving me food or fluids through my feeding tube. Your power of attorney can say to the medical professionals, I know they've got a tube, stop giving them anything. You have the right to say that. Just because you have a feeding tube doesn't mean it has to be used. Okay? You can do that for hospice. So you don't have to be in the hospital. If you choose to go on hospice because it's starting to get end of life, you can always tell hospice when you're choosing to stop using that feeding tube. Typically, if we're putting a feeding tube in, we're not going to take you through another surgery just to remove it. We just stop using it. So if you ever make that decision of, I don't want to use it anymore, we just stop using it. We don't take it out. But you have the right to say that. Your person can see and approve release of medical records and personal files. If you need to sign your name to get any of them, your healthcare agent can sign it for you. Your healthcare agent can move you to another state to get the care you need or carry out your wishes. So let's say you decide you're taking the last trip on your bucket list. You want to go to Disneyland. Something goes seriously wrong. And you're at end stage, whatever, and you're in a hospital in California and your wish was to go back home and die at home. Your medical power of attorney has every right to say, I want him discharged. I'm taking him back to Arizona. You don't have to necessarily take them back to Arizona just because you want care here, although you can say that. You have every right to say, I want this person moved back to wherever. If you were born and raised in Minnesota and you want to go back there, you have every right to ask for that. Authorize or refuse to authorize any medication or procedure needed to help with pain. So sometimes patients get to the point where doctors are saying it's time for some morphine. That's the typical medication that we use when we're getting to end stage with ALS patients. Your medical power of attorney can say, he or she did not want this, and that's fine. I do want to kind of caution everybody on this. We've had lots of families over the years that are very confused about morphine and whether it should be used or not, because they're afraid that that medication is going to speed up the process of death. I will tell you that any dose that is given, whether it's in a hospital or whether you're at home and hospice is ordering it, they are never going to order a dose that is going to kill the patient. And morphine can be ordered every hour. That medicine is given for comfort. It's not given to make the patient die quicker. So I just want healthcare powers of attorney to understand that you are not giving a medication that is going. Now, if you give the whole thing, that's a different story. But if you're giving what has been prescribed, you are not, making the death come any quicker, right? Okay, we're just doing it for comfort. So don't be afraid to use that medication. I think what I caution the patients on is if we start to use those meds, you do have to understand that it is going to make you more drowsy. You're going to be asleep more, things like that. So lots of times I'll tell patients, listen, if there's anything that you want to tell your friends and family, that sort of thing, like if this is really, you're actively dying and you're in that phase, then maybe you want to have those conversations before we start bringing on those drugs all the time. But it is not going to kill you. It is only going to make you comfortable. Okay, your healthcare power of attorney can take any legal action needed to carry out your wishes. So if an attorney needs to be hired for any purpose, they can do that. They can donate usable organs or tissues as allowed by law if you're a donor. However, I will tell you that most times if you have a diagnosis of ALS, they won't take your organs. Stupid, I think, but they won't take them. So you can always call and ask. There is whole body donation. Barrow has a program, so if you are interested in that, you can donate your whole body to ALS research. But as far as organ donations, even if you are an organ donor, most times they will not take them with an ALS diagnosis. Your healthcare agent can apply for Medicare, Medicaid, or other programs or insurance benefits for you. And that may mean that they have to see your personal files. Usually those sorts of programs require a financial obligation. So they would see bank records, things like that. So the reason why this is brought up is, yes, as a spouse, you probably already know, but like in my case, it's my best friend. She doesn't know what my bank account is, but I know that she has the ability to look at that if that would come into play. So, and then the last one on here says, any changes, additions, or limitations on my healthcare agent's powers. So that's why it gives you those lines and that space to be able to write down any other thing that you might want in there. I will tell you that this document is a medical power of attorney. It is not a mental health power of attorney. That is a separate document. So sometimes I tell patients, if you are interested in that free area, I might write that my healthcare power of attorney is allowed to make decisions about mental health medications, admissions to facilities, that sort of thing as well, just to kind of cover that base a little bit. But that's up to you if you want to add that a little bit. Because a mental health care power of attorney is a separate document, some people might say, nope, we're not going to take that on this. Other people do. So it's really kind of up to that physician as to whether he will take it or not. But I say throw it in there if you're interested in it, and then hopefully they will take it. If you change your mind about anything in this document, you can either destroy the document, tell your doctor, obviously, that you want to cancel it, or you simply write the word revoked over the front of it, and then this document is null and void. Okay, page number 6, wish number, well, maybe 2. Okay, this is probably, these next 2 pages are probably the most important for ALS patients. So this is the wish for the kind of medical treatment that you want. So the first says, what you should keep in mind as my caregiver. I don't want to be in pain. I want to be comfortable. Wish number 3 will talk about ways to keep you comfortable. So I think we all agree with that. None of us really want to be in pain and want to be comfortable. So I think we would all keep that the same. I want to be offered food and fluids by mouth if it is safe for me to eat and drink. I always say, lots of ALS patients get a feeding tube, and it's not always safe to eat or drink by mouth, but you also have every right to do that. It doesn't matter whether you have a feeding tube or not. You know whether it's safe to eat or drink by mouth, and you still have the ability to say, I want a pleasure bite, I want a drink, I want whatever. You have the opportunity to do that. This whole thing is talking about an end of life issue, And I would never tell somebody you can't have that last drink or that last whatever you want to eat. I had a patient that died about 9 months ago, and he decided to stop eating and drinking by feeding tube. And so I went to him. I was several days in, and I said, "Is there anything, Bob, that you want to eat or drink?" And he goes, "Yeah." I said, "What?" He goes, "Starbucks." So his family brought him a grande, and he took one sip, and he said, "I'm good." Now, if I only had one thing, it wouldn't be Starbucks, but that's what he wanted. So I'm just saying, you do have the ability to take something by mouth, even if you have a feeding tube. If you want something, ask for it, right? Like, you have the ability to ask for that. I want to be kept clean and warm. I think that's kind of a given. And then I don't want anything done or admitted by my doctors or nurses with the intention of taking my life. There are some other states that allow us to do that. We don't have that ability in Arizona. So if you were to move to Oregon and do death with dignity, then that might change that intention. But okay, next paragraph. What life support treatment means to me. So this is what it means typically for medical professionals. It means any medical procedure, device, or medication to keep me alive. Life support includes medical devices put in me to help me breathe. We'll talk about that in a second. Food and water supplied by a medical device, a feeding tube. CPR, major surgery, blood transfusions, dialysis, antibiotics, and anything else meant to keep me alive. If I wish to limit the meaning of this because of religious or personal beliefs, I write the limitation in the space below. Okay, so now we're going to talk about what some of these specific things mean for ALS patients. First thing is devices putting me to help me breathe. So I kind of touched on that a little bit before with the example that I gave earlier. So if a patient, doesn't matter whether it's an ALS patient or not, if any patient goes into respiratory distress and they are not able to breathe on their own, a doctor will likely put an intubation tube in. So that is a tube that is in your mouth, goes down into your lungs, and then they use a bag or they will hook you up to oxygen, that sort of thing. That intubation tube, it's also called an endotracheal tube. That intubation tube is a temporary tube. It can only be in 5 to 7 days max. And then the doctor has to make a decision. Is this patient better and we can take it out and can breathe on their own? Or is this patient not better and is not going to breathe on their own? And the other option is a permanent solution, which is the tracheostomy and put on mechanical ventilation. If a patient needs a temporary tube, let's say they have a bout of pneumonia and they really can't breathe because their lungs have a lot of fluid in them, we might put an intubation tube in an ALS patient and give them a few days of antibiotics and let those antibiotics work, and then they're doing a whole lot better, and we take that tube out and everything's fine. But if we're truly talking about respiratory distress and ultimate respiratory failure because the diaphragm is no longer working on an ALS patient, then we are talking about going to mechanical ventilation. If that patient is no longer able to breathe on their own, we're looking at mechanical ventilation. So that's a whole nother can of worms, right, that we've just opened, because mechanical ventilation requires 24-hour care, especially right after you get trached. There's a lot of sputum, a lot of fluids, a lot of spit, saliva, everything else. You need suctioned very frequently, like 10 to 15 times an hour. That's why you need kind of that 24-hour care all the time. So that's why we're looking at, okay, you need multiple people to maybe take care of you. So 2 options if you do mechanical ventilation. 1, you go home, which is possible, but you need multiple people to take care of you, right? Even if the primary caregiver, who's typically the spouse, says, I'll do it, you still have to sleep, right? You still need, and even if you only say, I'll take 6 hours or 5 hours of sleep. You still need to sleep. So somebody else, while you're sleeping, has to be watching that ventilator, listening to the bells and whistles, being able to suction when you need to suction, that sort of thing. Or you go to a facility that has 24-hour care, right? In Arizona, in the Valley, there are 2 agencies that provide vent-trained nurses. Only 2. There are lots of agencies, but only 2 have vent-trained nurses. It's not covered by insurance, just so everybody knows. This is all an out-of-pocket expense, and those vent-trained nurses start at $85 an hour. Start at $85 an hour. They will charge you if you're out of the area for mileage. They may go up from there. They may charge you more if it's a night shift. They may charge you more on the weekend, all of those sorts of things. So I can tell you right now, I just went out and saw a patient who's been on a ventilator for 3 years, and her husband is paying for 12-hour care Monday through Friday during the day, 7 a to 7 p.m. He's paying $12,000 a month for care. He still has her every night, and he still has her on the weekends by himself. So it is a financial obligation to be on a ventilator, correct? Also, we've had some patients that say, okay, I'll take a ventilator, and then they live in an outlying area and they think they're going to go home, and then they realize there are no vent-trained agencies that live in their area. And then they're stuck in a facility because there aren't any agencies that they can hire. So do your homework if that is an option for you. Always do your homework. If you want to go home, are there agencies that you can hire? If you want to go home and you're not going to hire an agency, do you have enough friends and family that are going to make those accommodations? And the reason why I say that is you can, as a caregiver, you can say, I'm going to do it, but what if you get COVID? What if you get the flu? What if you need a procedure like, oh, I need my hip replaced, my knee replaced, somebody's sick, somebody's graduating, somebody's having a baby, I want to take a vacation. All of those things you have to consider. So it goes into play. So that's a big thing. The other thing too to consider about a vent, you must decide when you want to go off of that vent. Here's the reason why. Some patients are on a ventilator and they get an infection. It's typically pneumonia, and that's what takes their life, right? That pneumonia is too bad, the infection is too bad, and that's ultimately what they succumb to. But that same person that I told you the husband is paying $12,000 a month for, the reason why I went out to that house is because the husband doesn't know if she has adequate quality of life anymore, and he is financially drained, and he wanted me to determine whether it's time to take her off of a vent. And the woman has no way to communicate other than looking at your hands and answering yes or no questions. She'll look at my left hand if it's yes, and my right hand if it's no. So I had to only ask questions that were yes or no to try to determine, do you have an adequate quality of life? Do you want to still be on this ventilator? That's not an appropriate way to live your life, right? So if you're going to make the decision about being on a ventilator, at least decide, these are the things that I've determined as not quality of life, and when I want my family to say it's time to bring in hospice and remove this device from me. And I know it's a terrible thing to talk about, right? But there are too many families. I ran the grief group for a number of years, and there are too many families, and the number one thing that they say is they feel guilt. Did I do it the right way? Did I do enough? Because you never had that discussion. So at least give your family members the ability to know what you want and when you want it done, so that they don't feel guilty over, did they do enough? Did they do the right thing, wrong thing, that sort of thing. It doesn't matter what you decide. Just make sure that your wishes are known on any of those things, right? Because then it will be an easier process. If you do choose the ventilator option, and you've also said, okay, after my kid graduates for college, or I have a grandbaby on the way, and as soon as they're born, then I'm out, or whatever. Who cares what it is? Then it's not just, oh, well, we just go and pull the plug, right? It is a weaning down process. We call in hospice, they medicate the patient, It is a slow turning down of the process. It's very comfortable. It's a very good process. So I don't want people to feel like, oh gosh, how does that happen? You know, we will work with you on arranging hospice and having all of that happen so that it's good. So that's one of the things that you have to think about in life support. Do I want intubation only, which lots of ALS patients say, hey, I'll take that intubation tube. Maybe I do just have a very bad case of pneumonia and I want a few days of antibiotics. Then in that form, intubation only, right? But if you want full mechanical ventilation, if you are choosing the tracheostomy and mechanical ventilation option, then you leave all of that as is. That's full life. We're doing everything we can to save your life, right? The next thing on here that I just want to briefly talk about is CPR. So CPR means that also your heart has stopped beating, right? So it's not only you're not breathing, but we have a heart issue now too. So sometimes patients say, well, what if I have a heart attack and my heart stops? Like, I want them to do CPR. But you have to think about what the mechanics are involved with that, really. And I'm trying not to be morbid here, but I really want you guys to understand this. If your heart stops, the reason why we're doing CPR is because we're trying to perfuse the blood throughout the body. We're still trying to get all of that oxygenated blood to all the organs, right? So how long does it take before your heart starts again? Number one, if I'm doing CPR correctly, I'm breaking some ribs, right? So you can't do anything for broken ribs. They're just sore for a while. So first of all, you're probably going to be sore for a little bit. That's not fun. But also, how long are you down? How long is that heart not beating before we get it restarted again? And if you were 100% mentally, but you're down for 3, 4, 5 minutes, are you now only 60%? And guess what? You still have ALS. So you have to think about that. If my heart stops, do I really want them to go through all of that? And then I still have ALS, but now I might not be completely there mentally because I had that many minutes of deprived oxygen from my brain. So it's something to consider. Do you want CPR or not? So just think about that option too. Okay, any questions about that? What life support means? Okay. Okay, if you truly want to be do not resuscitate, I want nothing. I don't want an intubation tube. I don't want CPR. I want nothing. I'm going to let nature take its course. When the time comes, the time comes. Then there is something called an orange form that you can have your doctor fill out. It actually goes on your refrigerator. All EMTs, medical professionals, emergency people know to look for an orange form. So if 911 is called, let's say, then you don't have to worry about it. If a neighbor's with me, you don't need to tell every person that comes into your house, I'm a DNR. You can simply know that that orange form is there, and any medical professional, emergency professional that comes in will look for that orange form first before they start performing any life-saving procedures. So you can certainly ask your doctor for the orange form. There's also something called a POLST. It's a physician order for life-sustaining treatment. It is an order that your doctor will write to if you want to get into detail about what, if any, things that you want for life-sustaining treatment. They can write an order for you as well, and that kind of accompanies the orange form. So you can talk to your doctor in more detail about that. Okay, page 7. Okay, so these are a few situations of when you're very much close to death and what you want to have happen, right? So the first one is, if my doctor and another healthcare professional, and so just so you know, these all will say that. So if you are in a very close to death situation, you must have 2 different doctors verify it. Your doctor and another one. One doctor can't just come in and say, yep, I think he's going to die. Has to be 2 individual doctors. So they all say this, 2 healthcare professionals. So if my doctor and another healthcare professional both decide that I am likely to die within a short period of time, and life support would only delay my death, then yes, I want life support. No, I don't. Or I'm going to have life support if my doctor thinks it could help. So let's think about ALS again, though. We know that ALS is a life-limiting disease, right? There is no cure right now. So in that scenario, what life-sustaining treatment is the doctor going to give you that's going to help? Right now, there isn't any, right? So that's kind of a different situation for ALS patients. I think that in certain situations, it could be maybe comfort drugs, but I think they would already have those on board. So really this becomes a situation of, do I want it or do I not want it? You know, all of these situations are, I'm likely to die in a short period of time, and life support is only delaying that moment of death. So remember that. Okay, second scenario, if my doctor and another professional decide that I'm in a coma from which I'm not expected to wake up or recover, and I have brain damage, and life support would only delay the moment of my death. Yes, I do. No, I don't. Let my doctor decide. Okay. Next one. If my doctor and another health professional decide I have permanent and severe brain damage and I'm not expected to get better, and life support would only delay the moment of my death. Yes, I do. No, I don't. Let my doctor decide. Okay. Now, the last one here says, if there is another condition under which I do not wish to have life support treatment, I describe it below. In this condition, I believe that the costs and burdens of life support treatment are too much and not worth the benefits to me. Therefore, in this condition, I do not want life support treatment. For example, you may write end stage condition. That means that your health has gotten worse. You're not able to take care of yourself in any way, mentally or physically. Life support treatment will not help you recover. Lots of times patients will write end stage ALS, right? If you know that you're at the point of end stage ALS, I do not want anything else. Okay, questions on that page? Okay, wish number 3. Now they get a little bit better. Okay, wish number 3 is how comfortable you want to be, right? Okay, so once again, remember, if there's anything that you do not want, we're going to cross it out. I don't want to be in pain. I want my doctor to give me enough medicine to relieve my pain, even if that means I'll be drowsy or sleep more than I would otherwise. So remember, I talked about that morphine, and it will make people drowsy. I always will tell patients, like I said, there are things you want to say to friends and family. You might want to start having those conversations before morphine starts to be administered. Now, lots of times ALS patients will start morphine and maybe it's only given as needed or a couple times a day. That's not what I'm talking about. That might give you a nice nap for an hour, but it's not going, if we're giving morphine every hour, then that's going to be that sustained sleep kind of thing. So that's what we're talking about. All of these wishes are kind of the active dying phase at this point. If I show signs of depression, nausea, shortness of breath, or hallucinations, I want my caregivers to do whatever they can to help me. Kind of sounds like a given. I wish to have a cool, moist cloth put on my head if I have a fever. Sounds like a given. I want my lips and mouth kept moist to stop dryness. Probably so. I wish to have warm baths often. I wish to be kept fresh and clean at all times. Probably so. I wish to be massaged with warm oils as often as I can be. I met with a lady, this was years ago, and I was just meeting with her as an end-of-life doula, and she said, I am crossing that out. And I said, okay. And she said, well, I am very susceptible to fragrances and things like that and oils. I don't want any of that. I'm like, okay, that's fine. She also crossed out the moist cloth on her head. She said, I don't want anybody touching my face. Like, okay. If I'm not able to control my bowel or bladder functions, I wish for my clothes and bed linens to be kept clean and for them to be changed as soon as they can be if I have been soiled. I would put a star beside that if it was me. I wish to have personal care like shaving, nail clipping, hair brushing, and teeth brushing as long as they don't cause me pain or discomfort. I also kind of think that this should be starred. I think these are very important things. I can't tell you how many times as I was a ALS clinic coordinator, no offense men, but they would bring their wife patients in and the wife's hair would be all like this. Like, could you at least run a comb through your wife's hair before you brought her to clinic? You know, like, think about those sorts of things. Like, it is still a dignified thing to have your hair brushed and your teeth brushed and things like that. I wish to have religious or spiritual readings and well-loved poems read aloud when I am near death. There are people that are not spiritual at all, so if you are not, cross that out. I wish to know about options for hospice care to provide medical, emotional, and spiritual care for me and my loved ones. Most people will ask for that option, but if you really don't want hospice, see me on a side note because I'll talk you out of it. It's the greatest thing ever, and I think that people have a misconception about hospice. So if you really don't understand hospice or what's involved, please at least talk to us before you make that decision. Okay, wish number 4, how I want people to treat me. I wish to have people with me when possible. I want someone to be with me when it seems that death may come at any time. So this sounds like a given. Yeah, of course, I don't want to die alone. But I don't know if any of you can recall a scenario, but most people I talk to can say that they had a great grandmother or a great uncle or somebody that was on their deathbed in the hospital, and we were there for days and just waiting for grandma to die, and we set vigil beside the bed, and then as soon as we all went for a cup of coffee in the cafeteria, grandma died and nobody was in the room, right? There is a reason why that happens. Sometimes people don't want their loved ones to see them die. So if they cross it out, don't be offended by that. Like, we all don't know what death is like for us, right? So sometimes people say, geez, I don't want my spouse to see me actually do that. Other people are like, hey, you know, I do want them there. I want them there because I don't know what it's going to be like. So that's just the scenario sometimes that people are in, is maybe I don't want them to witness it. I wish to have my hand held and to be talked to when possible, even if I don't seem to respond to the voice or touch of others. I don't know how this study was done, but there have been studies done saying that the hearing is the last thing to go. So I'm sure that they can hear you. So if you want them beside your bed, that is what that means. I wish to have others by my side praying for me when possible. Again, if you are not a religious person, you might want to cross that out. I wish to have members of my faith community told that I am sick and asked to pray for me and visit me. Same thing again. I wish to be visited by a chaplain or a clergy. Hospice does provide that as well. So even if you aren't a member of a church, when you are involved in hospice, I mean, there are lots of times that people are not religious at all, and then at the end of life they kind of have a different philosophy and they want to talk to someone. So hospice does provide that if you are interested in that. I wish to be cared for with kindness and cheerfulness, not sadness. I wish to have pictures of my loved ones in my room near my bed. I wish to have my favorite music played when possible until my time of death. And some people are always kind of like, what? And I will tell you, I went to an ALS patient's apartment. This is somewhere downtown here, but the husband wanted me to be there. The wife was transferring from her apartment to inpatient hospice. She did not want to die at home because she did not want her husband to have to live in the home where she died. So she wanted to go to inpatient hospice to die. And so he wanted me there when hospice was coming to get her. So they were in this sky rise apartment complex, whatever. And I get off the elevator and I hear this music. And it is like this death metal Like, I don't know what it was. And as I'm walking down the hall, I'm realizing it is where I'm going, like, uh-oh. And so I'm knocking on the door. I had to knock a few times. And finally, the husband comes to the door and he could see the look on my face. And he's like, it's her favorite band. It's what she wanted playing. Like, okay. So if you have favorite music and you want it played, have it played. I want to die in my home if that can be done. Same thing with that woman. Like, most people want to die in their home, but you don't have to. If you want to die somewhere else, say so. You have the opportunity to move to inpatient hospice or something like that, if you don't want to die at home. And then I wish to be called by my name. I mean, there are lots of people that their first name is William and they go by their middle name or whatever. Maybe you have a nickname that you prefer to go by. At least say what you want to be called. I think that, if you have hospice come in and you want to go by TJ or something like that, they're going to look at the report and your first name is Thomas. Like, maybe you don't ever, you were only called Thomas when you were in trouble with your mom, like, maybe if you want TJ, put it in there. Okay, wish number 5. This is pretty much after you're gone. Okay, this is what you want your loved ones to know. I wish to have my family and friends know that I love them. I wish to be forgiven for the times I've hurt my family, friends, and others. I wish to have my family, friends, and others know that I forgive them for when they may have hurt me in my life. I wish for my family and friends to know that I don't fear death. I think it's not the end, but a new beginning for me. I wish for all my family members to make peace with each other before my death if they can. I wish for my family and friends to think about what I was like before I became seriously ill. I want them to remember me in this way after my death. I wish for my family and friends and caregivers to respect my wishes even if they don't agree with them. Most patients put 2 stars beside that one. I wish for my family and friends to look at my dying as a time of personal growth for everyone, including me. This will help me live a meaningful life in my final days. I wish for my family and friends to get counseling if they have trouble with my death. I want memories of my life to give them joy, not sorrow. Then after my death, do you want to be buried or cremated? If you know, circle one of them. Then no matter what it is, where do you want it to go? If you want to be cremated, where are those ashes going? So my late husband passed away and I did know he wanted to be cremated, but we never talked about ashes. So guess what? He's on a shelf in my living room right now. And I have to decide what am I going to do with it, right? Like we didn't talk about that. So if you do know what you want done with your ashes, please write them on there. If you want buried, where do you want to be buried? If you were in the service, do you want full military service, that sort of thing, what kind of things do you want done? And then who knows these wishes? If you've told somebody, please write their name in there. If anyone asks how I want to be remembered, please say this about me. Some people are very opinionated about, I want people to remember me like this. So please write that down. Even if you're not doing your own obituary or your own eulogy or things like that, this will help other people to write those sorts of things. If there's a memorial service for me, I wish for this service to include the following. So lots of people have very specific music or poems or different things like that they want read. If you have those sorts of things, you can write that in there. It's important for my healthcare providers to know what matters most to me. I wish for them to know the following if there's anything specific that you have in there. And then the following is any other wishes that you might have. Lots of times I put in here, if lots of times people will say, like, in lieu of flowers, please donate to blah, blah, blah. If you want money to go to ALS Arizona, right there, the Humane Society, all those sorts of things, like, please put it in there so that your family knows, like, where you would want donations to go to. Okay, and then this page is where you would actually sign when you are ready, but you are going to sign it in front of those witnesses, correct? So do not sign until you have the witnesses ready. But let's just look at that witness statement right there so that you understand who can be a witness for you. They have to be over 18 years of age, and they cannot be an individual appointed as an agent, proxy, surrogate, patient advocate, or representative by this document or your successor. They cannot be your healthcare provider, including an owner or operator of a health, long-term care, or other residential or community care facility serving you. They cannot be an employee of your healthcare provider. They cannot be financially responsible for your healthcare. They cannot be an employee of your life or health insurance provider. They cannot be related to you by blood, marriage, or adoption. They cannot be a beneficiary of any legal instrument, account, or benefit plan of yours. And they cannot be a creditor of yours. So that's why I tell patients a lot of times, I love this document, number one, because usually when patients are doing this, they're pretty immobile and they're realizing that, I need to do this, and they can't get to a notary. So we do this at home, and I say, go get the neighbors. Bring the neighbors across the street and have them witness it for you. So after you've completed it, then obviously just make sure that your healthcare provider does know that you have it. So you can take it to Barrow, Honor, those places. They will scan it into their system. Make sure that all 3 people that you've listed on that front page of your healthcare power of attorney all have a copy of this. And literally, like I've told women, like if your patient, if your person is the patient, like keep a copy of this in your purse. So if you have to go to the hospital, like you can say, here it is, like this is what he wanted, kind of thing. So you can certainly make changes to this as well. Like people can change this as many times as you want. So if you decide you're going to go home today and do this, it doesn't mean that in a week or in a month or in a year, you might decide on different things. You have the ability to change this as many times as you want. It just needs new witnesses. We'll do a new form, new witnesses, new signature. But you have the ability to change it multiple times, so you don't have to be locked into it. Okay, questions. It was a lot. The intention is not to do this immediately if you don't have to, unless you've already been thinking about it. The intention is, okay, I am not under duress. I am not under any kind of distress with my medical condition. Let's go home. Let's talk about this. If you have kids, it's a good time to bring up, this is what I want. These are, my opinions. What are your thoughts on it? That sort of thing. But too many times we've seen ALS patients that don't have this at all, and then it turns into a very sad situation. So certainly if some of the things that I've brought up to you have sparked even some fear about certain things, then please get a hold of me and we'll discuss it further. I don't want anybody to be fearful of anything. I just want you to be educated in making the decision. No matter what you decide, it's your desire and it's your prerogative to decide whatever you want. I just want you to be educated in making the decision before you do it. So yeah, question.
So once an ALS patient loses their ability to write, and if they do want to make changes to this, how would they go about signing?
So we can literally put a pen in their hand and it's just an X. They don't have to have a signature. As long as we see them doing that, and we have a way, we as the witness can say, are you in your right mind? Do we agree? As long as they can say that, yes, we agree that this person is in sound mind to say, we agree that they're signing, even though they can't write their full signature, then yes. So for instance, let's say they have an eye gaze or something like that, and they say, I want to sign this, then we can put the pen in their hand and they can do an X, and an X is a signature in the state of Arizona. Yeah. Other questions? All right, thank you all for coming. If there are any of you that do want to do this and want us to witness, then stick around and we'll be happy to witness for you. Yeah.
Janie, would you be willing to go to someone's house to be able
Yes,
to
yes, yeah. Yeah, and I will go in this in more detail. So for instance, if you heard all of this and you're like, oh, I really want to talk to my kids about this, but I don't know how to bring this up, we can have a family meeting and I can bring it up with kids too.